Hi, my name is Emma Morse and I use she, her pronouns. I'm a student pharmacist at the University of Minnesota, and today we will be talking about Advair Diskus, specifically how to use it, what it is for, some side effects, and safety measures of it also. This is what Advair Diskus looks like. You can see that it says Advair Diskus and there's the dose. Each dose varies depending on what your prescribers provide. You can see the thumb grip here and the dose indicator. So to prepare each dose, you're going to want to open the inhaler, revealing the mouthpiece. So you're going to push that back. Once you do that, it will look like this. Hence, you can see that now the thumb grip is here and the mouthpiece is here. There is a lever here. Once you reveal that mouthpiece, you'll hear that click and that it's now locked in place and ready for you to get the dose ready. You'll find the lever and you'll push that back and it's going to open the mouthpiece, making a single dose of the medication available. Be sure to keep the inhaler flat at this point, or else the medication will fall out if you tip it over. You'll then want to sit up straight and exhale completely, away from the inhaler. Then you will place your mouth on the mouthpiece and inhale quickly and deeply, ensuring that you're inhaling completely so that the medication reaches your lungs. Be sure not to breathe in through your nose. You can plug your nose by pinching it closed with your fingers if you have trouble with breathing through your nose and mouth. You'll then remove the inhaler from your mouth and try to hold that breath in for about 10 seconds or as long as you can comfortably do so. Then breathe out slowly. This ensures that the medication gets to where it needs to be in your lungs. So for example, you're going to breathe out slowly away from the inhaler. Upon returning to normal breathing, you need to rinse your mouth with water and spit it out, making sure not to swallow that water due to the fact that this medication can cause a fungal infection of the mouth if you don't. You can see how many doses are left by looking at the dose indicator right here, which is next to the thumb grip. After each use, you can wipe the mouthpiece off with a dry tissue or a cloth to clean it. You should keep the inhaler dry at all times, and when done using it or when not using it, you should take the thumb grip and lock it back into the original state so it looks like this again. And you should never blow into the inhaler at any times. When not in use, you should keep the inhaler at room temperature in a dry place away from any heat or sunlight. And then after a month of opening the inhaler, if all the doses aren't gone, you should throw it away, or when the dose indicator reaches 0, whichever comes first. Advair Diskus has 2 medications in it, one that'll decrease inflammation and another that will relax the muscles in your airway that'll help you breathe easier. It's typically used to treat asthma and COPD. It's a controller inhaler, which means that it should be taken every day, regularly around the same time to prevent asthma symptoms, and it should never be used as a rescue inhaler. They make other inhalers for that. It could take up to a week for you to see the full benefits of the inhaler, and if you feel like this inhaler isn't working after that time, contact your primary care provider for further assistance. If you miss a dose, don't try to play catch up or double dose, just continue with normal dosing the next time you're scheduled to take it. Some common side effects you may experience from using this inhaler include nausea, fungal infection of the mouth, which is why we have you rinse your mouth after, pain of the muscles, bones, tendons, ligaments, and soft tissue. You may experience dizziness, headache, and inflammation of the lining of the tubes that carry air to and from your lungs, difficulty talking or hoarseness, throat irritation, and even a respiratory infection. Monitor yourself closely, and if you experience or feel like you experience any of these common side effects, try to continue taking the medication, but reach out to your provider for further assistance on what to do from there. Although rare, some severe side effects include hypersensitivity of the medication, or an allergic reaction. You may also experience seizures, weakening of the bones, irregular or rapid heartbeat, heart attack, and pneumonia, which is an infection that inflames the lungs' air sacs. Monitor yourself closely, and if you experience or feel like you're experiencing any of these rare severe side effects, stop taking the medication and seek medical attention immediately. If after a week you don't feel a difference in your ability to breathe upon doing everyday normal tasks that you would before, reach out to your primary care provider. Lastly, if planning on becoming pregnant or pregnant, do not take this medication as it could harm the baby. There's also some non-pharmacological ways to manage asthma, including quitting smoking if you are smoking, controlling your environment by avoiding areas or surroundings that may induce asthma, staying informed about the proper ways to manage your asthma. You can keep an up-to-date asthma action plan if you were to ever have an asthma attack, doing physical activity that may improve lung function if your primary care provider says physical activity is okay. Practice good breathing techniques, and even eating a healthy diet can help improve asthma. If you have any further questions or concerns, please reach out to us, myself, or your primary care provider for further assistance, and I hope you have a good rest of your day.